Hello, thank you so much for joining us for today's webinar on school mental health as the foundation for academic success. Your presenter here today is Dr. Aaron Fischer. Dr. Fischer is the D-Endowed Professor of School Psychology, an adjunct assistant professor of psychiatry, and the director of the U-TTEC lab. He is a licensed psychologist and licensed board certified behavior analyst. He has worked with individuals with mental and behavioral health concerns and their families for over 15 years. His research focuses on the intersection of innovative technology and school mental health, specifically telehealth applications to support diverse students, caregivers, and educators. We're very excited to have you present today, Aaron. I'm going to go ahead and turn it over to you.
Thanks, Annie, and thanks to everyone who's joining, both our lab members and some folks who are from the community. We really appreciate you being here to learn about school mental health. I have some slides prepared for you all and some engagement opportunities, so get your phones out or another browser open so that you can easily access some of the engagement opportunities. That always helps me, just so that I can get feedback from you all and also learn about how you're all doing and some of your experiences. So with that, let me share my screen and my slides and we'll jump right in. Okay, so today's presentation is going to be on school mental health as the foundation for academic success. And as we go through this, like I mentioned, please don't hesitate to jump in with any questions that are coming up for you all. As I start all my presentations, I like to give a big shout out to our lab and all the great people I had the chance to work with doing all of the various projects and work that you see listed on the side here. We do a lot across Utah around school mental health, and so I'm really grateful for all the support that our team provides. The first thing I want to ask you all is, how are y'all feeling today? We're going to talk about school mental health. We're going to talk about mental health. So it's really, I think, important in my mind to understand how we're all doing. If you haven't used Menti before, Mentimeter is a engagement tool online. So if you go to www.menti.com and use the code that's listed here, or take out your cell phone, open the camera and point it at the QR code, that will allow you to interact with the quizzes that we have. And while you're doing that, I'm going to switch to a different shared screen so you can see the results. But don't worry, if you can't access the engagement tools, I listed the website and the code on top, so you can put those in again and respond. Thanks for folks who are responding. We have 2 folks who have responded so far, and we have 12 people on the call. I usually like to get like 50% engagement, and I feel like I'm doing okay. So if we could get a couple, we're there. Everyone's there. Thanks everyone for jumping in. So if we look at how we're all feeling, I empathize with you all. There's this mix of happy and exhausted. And if you notice, when I did this, I didn't just put one feeling. I had it so you could put multiple feelings, because I don't know about you all, but I exist in a space where I feel a lot of different things, and I kind of vacillate between those feelings, and sometimes I hold those same things at once. Happy exhaustion is usually a place that I find myself, especially during the semester. So I empathize with everyone else who's also in that space. Great, thank you everyone for jumping in. I'm going to go back to my slides, so we'll have one more engagement opportunity that way, and thank you everyone for jumping in. So let's talk about what are the needs for mental health in schools. And this probably is a review for folks who are on this call because you do this work, but let's contextualize it again. When we think about the prevalence of mental health issues, 1 in 25 adults experiences mental illness. And when we think about youth who are ages 6 to 17 years, about 17%. And so what we know is that it's a pretty substantive amount of the population. It's about 1 in 5. And these numbers are likely underreported. So although we say youth are reporting these things at 17%, it's likely much higher. And because of that, we really need to tune in on these things, because if left untreated, as we know, there can be really serious implications for mental health issues. And so the graphic on the right, which will just kind of help orient to the need for mental health and why these things are so important, is because when we're working in schools, we have so much that's on our plate. We're trying to practice our own self-care. We're trying to build our own confidence as practitioners. We're trying to manage our time, prevent burnout. We have staff and educator mental health and wellness. We're trying to provide mental health services for school leaders at times. So school administrators, people who maybe aren't always looked for the mental health services. We're trying to implement social emotional learning strategies. We may be dealing with trauma in our unique communities, or just higher proportions of trauma in our communities. And we also know that we're trying to do some of these skill-based things. So are we doing mindful practices? Are we making sure we're prioritizing mental health for our students? And so when you look at this kind of stacked rocks, and for those who like to hike, you might see these around Utah. Those are the carrots, right? When you're walking around, they're very fragile and they can fall down very easily. And so when we think about school mental health, it's really this very fragile system that's built on strong foundation, ranging from us being able to have good well-being and support for ourselves. That's hard. So that hopefully helps to contextualize some of this. And as we jump in more, another really important piece is thinking about the idea of risk and protective factors. And when we talk about risk and protective factors, what I really want to orient you to is risk factors are going to be the things that make it so you'd be more likely to develop mental health issues or have circumstances which are not going to lead to positive outcomes. And then when you have protective factors, these are going to be characteristics that could be within the individual or the community that really helps to foster resilience, help to protect against the risk factors that are there, and they're instrumental. When we think about all of our work, it's really about building these protective factors, building more resilience. And what's really exciting to see is the State Board of Education is really taking this model to really infuse this in the school mental health work. So it's all about protective factors and it's all about building resiliency. And how we do that, and I want you to take a second to study this, and this will be another engagement opportunity for you all, is pick apart on the left side risk factors and the right side protective factors. What is the thing that sticks out that insulates people from these problems? And I kind of made it easy for you. It's bolded in some capacities, but I won't point out where, but I'd encourage you to jump in the chat and just say, what is the one thing that stands out that you feel is the thing we should be focusing on from this perspective of risk and protective factors? Great. Thanks for folks who are jumping in. Everyone who jumped in the chat said the same thing. And so it must be really salient. Connectedness in as many spaces as possible. And what does that mean? Well, it's like how we're connected to our school and the school community, we're connected to our family. And these are all hinged on the relationships that we have with people. That's what connectedness really talks to. And so when we're thinking about what we can do in schools, at the end of the day, it's how are we building connections with our community, with families, with students. And at the end of the day, if we're doing that, then we're doing the work we should, and we're building protective factors that will help insulate from things that we know just exist in our communities. Thanks everyone for jumping in, I appreciate that. We said that these things exist in our community. So what does that mean and what's that context? Well, a lot of this comes this idea of trauma-informed services and the impact of aversive experiences, adverse life experiences that people interact with. And so let me set the stage for that. I will say before we jump into this, if folks on the call are interested in learning more, Molly Davis and Karen Menotis, who is the psychiatrist on our School Mental Health Collaborative, are collaborating to talk about trauma-informed services in schools. And so we're planning on replicating that presentation in the spring for folks who might be interested in learning a little bit more about how that pertains, especially with the intersection of psychiatric services. As we pull back and think to this screen that you're looking at now, and thinking about what we can do, oops, sorry, y'all, let me just maximize that. What we can do for our youth, we have to understand that there is sort of this variable experience that students that we work with have. If you look in the top left, there's going to be inherent stress that people will have in their day-to-day. And those are things that we help support people with. And through therapy, through good connectedness, through good support, most people can get through some of the stressors in their life. Oh, I had a really tough day, or I had a challenging time at the test, or I got a flat tire. Those are all things that we typically have support networks for. And then as we kind of move through this continuum, there's more stressful things that are tolerable because we maybe have more support or we have more scaffold to help us out. Maybe an example might be like a death in the family. So you're grieving and it's very stressful because you had a close relationship, but you have family, you have a religious group, or you have a therapist. These are all places that you can get connectedness. I think the piece that's really important that we should really orient to is this idea around toxic stress, around trauma, which is this idea of these things that people experience, particularly children that we're working with, and they don't have the capacity to deal with those things. They don't have the skills. So when there's things like abuse or neglect, or there's substance use issues in the homes, these aren't scaffolded for kids. And these cause profound impact because there's shame, there may be physical injury, there's emotional injury that can happen. And so when these things add up, these are the stressors that we know impact youth and have profound long-term impacts on them, both short-term and long-term impacts on them. And so as we're thinking about what those things could be, let me just orient your attention to the top right of the slide, where you see there could be a variety of different things. And we live in a system. We aren't just ourselves, and these things don't all revolve around us in those ways, but we exist within this system. And so of course we should expect that some of these things beyond just what happens in our home are also going to impact us and could potentially cause potential major trauma. We have tools that we can use. The ACEs, which is the Adverse Childhood Experiences measure, looks at the number, so it's just a frequency count of adverse experiences that you may have had as a child. And so as an adult, you could go back, take this and say, these are the ones that you've experienced. Now, this is important, especially as we think about our youth, because the more of these adverse childhood experiences you have, the higher propensity that you will have to be at risk to develop mental health issues and have profoundly negative outcomes when it's related to substance use and incarceration and other risk factors similar along those lines. So knowing those things, we have an obligation to try to ameliorate this in the schools. And that's where I think all of this work that we're doing in schools is there to try to create some insulation, some support for the students who really need these services. So let's think about schools as the hub for student mental health and well-being. Let's think about them as the central location where we can interface with all of these great community providers, which also can provide connection and support, and maybe even at times mental health services. But we have a captive audience for students. They're there all day, every day, for 6 hours a day. That's the place. It's going to be much harder to connect with some of these other places, but it's our duty, I think, as schools to serve as that hub and be the people who connect the community with the students and families and so on and so forth. So when we think about school mental health, we think about all the people in the community. I want to ask you all another question. We're going to go right back to the same Mentimeter, but what comes to mind when you hear school mental health? What are the topics that come in mind? What are the ideas? And so we're going to do a word cloud, so we're just kind of spitballing words. There's no right or wrong answer. Let me reshare the screen so you all can follow along with. Excellent. Thanks for folks who are responding. We got 6 responses so far. I really appreciate that. We're up to 7. You'll notice that when you respond to these, if people have similar answers, they get bigger. So the ones that are most likely chosen are in the middle and a little bit larger. So let's explore this a little bit as people are still responding. And thanks for everyone who is. Support. There's this idea of importance. There's a variety of different areas, interventions, psychoeducation. Those are great. Counseling. Pushed aside. Interesting. Valuable. Great. That's contrasting thoughts around these things. I empathize with that. Safe place. Great. These are all great topics I think that come to mind. I think about these as well. And thank you everyone for jumping in with that. So now that we're thinking a little bit about what the roles of schools and mental health in general, let's talk about what services might look like. And really the rest of this presentation is going to jump in and talk about what services we can provide, knowing that these will be foundational supports to our students to help them throughout what they experience in schools. We'll couch this in the MTSS framework, so multi-tiered system of support, knowing that more students receive these tier 1 universal supports. And then as students don't respond to the interventions that are in place at the more universal levels, we tailor, we individualize, and we try to support students who need it. And that tends to be less and less students if we have a robust system in place. And then of course, for students who need additional services than what would be available in the general education environment, we can always consider the necessity and benefit of special education services as an additive to this foundational multi-tiered system of support. How this relates to a multi-tiered mental health framework is similar. In tier one, and follow along with me, this is our model that we use for our well-being team program. So for folks who are on that project, this is probably familiar. But if not, let me just walk you through it. Tier one is when we have social emotional learning, we have school-wide supports, we have intentionality around school culture and climate, teacher well-being, and family involvement. When we think about tier two services, we're going to move up and think about check-ins and group activities. And then of course, in tier three, we're going to think about more of these individual psychotherapies. But what's really important to know is just because you're doing tier three psychotherapy doesn't mean there's not application of those skills in a general education environment, in a more universal structure. Everyone's going to benefit from learning about taking the four corner breathing, taking diaphragmatic breaths. So how we contextualize that so that it can be available in a tier one setting is really important. And as we go through this, what I want to hopefully have you all leave with is understanding that school mental health is a dynamic system, and that it would be advantageous for us to think about how these things apply across the continuum and not so much as siloed levels within this continuum. Of course, there's practical pieces that certain people could do, certain skills that make most sense, but thinking about how these apply so it feels like there's investment for everyone, I think is really important. Okay, this system that we just talked about, this multi-tiered model, then could be contextualized in this larger system where we have community supports that are also there to augment. And that's where I think our work in the School Mental Health Collaborative has really been amazing, because we're able to really start to make these connections and see this bigger picture so that we don't have to have schools doing this by themselves, or in some cases, the communities just doing it by themselves. The remaining content we're going to go through is going through those tiers. I'm going to start with universal supports at tier one, and then we'll move our way up to what these mental health supports look like at each tier. And then we'll have some time at the end for you all to jump in with any questions or comments, thoughts that you all have. So tier one, this is going to be an overview. I'll jump into each of these. We'll talk about well-being committees. We'll talk about school climate, social emotional learning. We'll highlight Second Step as a program that we've used in the past. One that I think, at least here in Utah, has gotten some pushback on, but we'll definitely spend some time talking about the idea of social emotional learning and knowing that there's a variety of curricula that are out there that you could use. We'll mention a little bit about Safe UT, and then also school-based mental health screening, which is really critical in this process. First, let's talk about well-being committees. These are the crucial committees at each of your schools that may route all of the information, all of the supports around mental health. You may have these committees already for students to help with classification, for evaluation, for special education services. But think about having a committee that is either that same committee or one that's really focused on well-being of the school, students, staff, everyone. And these folks would meet at least monthly to discuss school-wide well-being plans, which could be created, students who are at risk or experiencing mental health concerns, and really use the opportunity to problem solve access or practical issues around consent forms, around how we can message some of these things. And this is important because without this committee, it's going to be impossible to do this systemic change work. We also want to lead efforts to promote well-being throughout the school. So when we have this well-being committee, these are the people who are sending out the opportunities to do free yoga in the park, or saying, hey, there's this great free mindfulness app, or hey, there's this other opportunity within the school. Because I think everyone's busy, but we have to have people who are being intentional so that others see the intentionality that we would like to have behind it. And ideally, these teams would use a structured teaming approach. We use team-initiated problem solving, which is honestly just a structured way of running meetings that was developed through the University of Oregon. And it helps a lot, especially these school level meetings where we can spend a lot of time not talking about things that we really want to talk about. And then we're left kind of in a space of sort of ambivalence rather than change. And I think when it comes to doing work in a committee level, it's about having actionable change that you can do. And in this case, around mental health. Okay, so that's our well-being committee. I always like to encourage folks to include at least one parent, if they can, at least one student. Those folks would be excused when we talk more about sensitive student issues, but it's nice to have the perspective, because if not, then we're not really looking at the whole population and everyone we're serving. Let's jump in and talk about school climate. This, to me, is probably one of the most important things, and it's usually the part that takes the longest to develop in our school mental health programs, because it takes time. In our school climate model, and I'm sorry, some of this one on the top left is very small. I'm not sure why it's so small, is positive discipline. And this really speaks to, do we have PBIS structures in place? Are we really thinking about restorative practices? We also want to think about school safety for all students. And what that means is, do we have equitable safety procedures and plans so that we're not being disproportional in our procedures, but also making sure it's an environment where everyone's feeling welcome and safe and able to connect. We want to make sure there's positive prevention systems and effective interventions. To do that, we'd have to have great teaming. PBIS kind of relates to some of this, but we need to make sure that we're using evidence-based strategies. The other piece that I think that's really important, maybe the most important thing when it comes to school climate, is this idea of cultural competence and how we're being culturally responsive in our various communities that we're working. There's not a one-size-fits-all school climate, because each climate is representative of the community that it serves. But understanding what we can do to be representative of our student populations, of our staff populations, of our families, that's going to be really critical. And that really takes a lot on us to be humble and to be reflective and understand that we have a lot to learn. And usually when I'm working in these school mental health programs, so much of the first year is really just understanding the climate and culture of the school so that we can learn to be collaborators and learn to help support. We also want to think about homeschool collaboration. The school climate is so related to that, because parents are the #1 predictor of success for students. If they're involved, they're going to be successful. And if they're not involved, then it's really going to be a problem. So having that strong connection is going to keep them there. It's going to help them be informed. It's going to help them be your ally, rather than seeing the school, the institution, as this enemy or someone that they could resent. And then last but not least is the connectedness to school, which is related to all these things. You feel connected when you walk into a building and you feel seen and acknowledged and validated. And it's hard work. And it takes a lot on the adults to create a space where students can feel vulnerable and feel safe to be there and to be honest. So we really need to focus on school climate at the Tier 1 level. And this brings us to social emotional learning, which is a great strategy of what we can do practically at the universal level to start building the connectedness in the school. And so this is a great model, CASTLE, which is the Collaborative for Academic and Social Emotional Learning, which is essentially the leading authority on social emotional learning. And essentially in this model, they present 5 main areas which make up SEL. Those are self-awareness, self-management, responsible decision-making, social awareness, and relationship skills. And what's important to know is that these skills, these topic areas are contextualized within curriculum and instruction, school-wide practices and policies, and also family and community partnerships. So we have to have SEL infused everywhere. And without that, we start to see some resistance. And so I think we're experiencing some of this in Utah, as we've seen SEL kind of come in the forefront of criticism around what we can do to help students in schools. Let's dive in a little bit more. What do these topics mean on a practical level? Well, when we're thinking about identifying emotions and self-regulation, we're thinking about building empathy and peer connections, respecting people's boundaries, promoting positive mental health, and also encouraging decision-making and problem solving. These are the skills that we're trying to get folks to have. And as you can imagine, if you can navigate these social emotional skills, you can do okay, but they're hard. And if we don't teach these things explicitly, then people don't know these things, and then there's missteps, and they're going to have a tough time identifying their emotions, and they might be dysregulated. They may make poor decisions because of that, and they may not respect people's boundaries. And so you can see these things kind of add up. And so they're all interconnected. It's very important that we teach all of these skills. And kind of in sum, if you're thinking, okay, well, what can I do? How can we infuse these things, or what are the things I need to focus on? These are kind of the topics that really are salient for me. Spend time connecting in whatever capacity that means, with students, with staff, with parents that are in your community. And it takes effort, it's intentional, but make the efforts, it pays off. Be active within your community. Doing this work means that there has to be people who have a voice. They see the rationale for these things, but being active within the process. And then also second to that is being physically active. When we think about Tier 1 supports, one of the best things we can do is to get outside and to engage and to move our bodies around. I think so many times especially in schools, we forget about those things. We also need to be more aware, just to take notice of all the things that are happening around us and how those things might affect other people, what are the implications, and to think about how we can give more love, more compassion, both to ourselves, but also to others. That's really important. and to keep learning. I mentioned the humility piece. We don't know anything really at the end of the day. We think we do, but if we have this open mindset, we can continue to refine what we think we know and help be successful in the work we do. All right, so the last thing, or the last couple of things around social emotional learning, or I'm sorry, universal supports at tier 1, is what we can do from a prevention standpoint, especially for high risk situations. And so when it comes to prevention efforts, I really love Safe UT. Safe UT is a free app that the Department of Psychiatry at the U put out. And I'm sorry, I realize this is an older slide presentation because Safe UT has recently come out with a new logo for their app. So my apologies, but it's the same functionality. It's a crisis line. It has the ability to chat live with folks or call in. And you can also submit tips. So if you have a friend or someone you might be worried about, you could say, okay, well, I think that person maybe needs some more help. The only thing we have seen in that is some kids are like pranking each other by saying their friends are needing help but not actually. So there's some, real issue with that, because then I think it waters down the utility of the system. But I think they've been doing a really good job of navigating some of that. And it's just nice to have a resource. If I recall, I was in a meeting with the Huntsman Mental Health Institute folks who are doing this, and they said somewhere around 300 individuals, they have data to say that they were able to divert the trajectory when there were instances of suicidal ideation. And so they would say that those averted suicide. And I think that's just really amazing to show the value of a system like this, where just having someone to talk to can really dial down the temperature and help people feel more safe. Because I think that in those moments, especially for our youth, they can feel like the only thing that's present, and a lot of it needs to just have some space to someone to talk to and kind of de-escalate in those moments. The other thing I wanted to mention to at Universal Supports is selfishly some of the work that we've done in the lab around being able to support through videos. We have these burst videos, which we collaborated with the Grant School District last year, and many of our exceptional graduate students and undergraduate research assistants helped to develop this content. If you go on the QR codes on the bottom, you can follow your favorite social media platform, but we have, particularly around the tier 1, videos to help with social emotional wellness and support. But there's a wealth of great stuff on the internet now, particularly after the pandemic, when many people put a lot of these asynchronous videos around mental health supports out there. So this is just one option, but I'd encourage you all to think about easily accessible tools and videos around these topics that you can share with families and educators, as well as your students. This is just an example of one. Let me just make sure my audio is shared. Okay. And we'll watch this one just to get a sense of what it looks like. Oops, sorry, everyone.
Life is full of transitions and changes. These changes can lead to uncertainty and anxiety about the future, especially when we focus on all the negative possible outcomes. Try the following activity to help you cope with uncertainty about the future. Make a list of the worst-case scenarios that are coming to mind. How could you handle it? What would you do to cope? Make a list of the best-case scenarios. How could you handle it, and what would you do to cope? Lastly, make a list of the most realistic outcome. What would you do in this situation, and how would you cope? Pondering the possible outcomes and what we would do can help us feel less anxious and more prepared to face the future.
Okay, thanks everyone for checking that one out. And shout out to our graduate student, Morgan, who developed that one. I think that these kind of quick videos are really useful for people on the fly, and just being able to give some intangible skills is really empowering in moments where you don't feel like you have anything. And so this is a strategy for sure. All right. The last piece I want to mention around tier 1 before we switch gears to tier 2 and 3, which I think are less to talk about because I think they become more explicit, is this idea of measuring student well-being, screening for mental health issues in a tier 1 capacity. And so when we think about screening in general, it's this idea that we can gather information. And rather than me try to explain this to you, our School Mental Health Collaborative recently have developed some great content, just helping parents particularly to understand why we would do some of the screening work. And so let me just pull up that video just to show you all. And a big shout out to our School Mental Health Collaborative team who put this work together.
Hi, my name is Jocelyn Kazer Kodama. I am a parent and a graduate student at the University of Utah working with the Utah School Mental Health Collaborative. As you may remember, this is a statewide project created to improve the overall quality of well-being support and available resources at your child's school. Let's talk about the well-being screening process. Well-being refers to the overall sense of happiness and contentment your child experiences. At school, it significantly influences their sense of belonging to the community, as well as their feeling of purpose and joy in learning. Our goal is to help your child experience lasting well-being. Well-being screenings resemble other routine health screenings such as hearing and vision exams and reading screenings. Vision and hearing screeners conducted by the school nurse identify sensory medical needs students may have and allow them to utilize appropriate interventions to help students learn. Teachers conduct routine reading screenings to identify students who need extra reading support and to monitor progress across all students. Well-being screenings work in a similar way. Well-being screening happens several times a year in your child's school. First, school staff will send you the screener and a form to consent to your child's participation in this school-wide screening process. If you have any questions about screening, you can schedule a meeting with the school's counselor or administrator. Screeners provide valuable insight into the essential dimensions of well-being for students at school. Research shows that when students report higher levels of social connection and personal well-being, they have improved academic outcomes. Furthermore, if screeners show needs in a student's well-being, school counselors and staff are better able to support them. By creating a consistent screening routine, we can better track where students are thriving and where they may need additional support at school. In doing so, we aim to create a culture of belonging and engaged learning for our students. This is what education is all about. Follow us on social media to learn more about the Utah School Mental Health Collaborative.
All right, thanks everyone for checking that out. We think that really helps to really explain some of this work. And so when we think about doing the screening, what we like to use is the Student Subjective Wellbeing Questionnaire, which was developed by Tyler Renshaw at Utah State University. He's the training director for their school psych program and a great colleague. And he really wanted to kind of diverge from this deficits-based screening model where we say, are you anxious? Are you depressed? Do you have these symptoms? And really moving to this model of strengths and really looking at things like, are you excited to learn and come to school? And so it's broken down into these 4 categories: joy of learning, school connectedness, educational purpose, and then academic efficacy. And so as you can imagine, these are positively framed. So as a parent, if you see these things, as a kid, if you see these things, you can say, yeah, I can fill this out. And what we can infer is the same levels of risk. We can say, if you're not connected to your school, you're at risk, and we're going to have to help support maybe a little bit further. So that's why this school-wide screening is critical. And although some schools may be apprehensive and say, well, if we identify all these students, we're going to have to serve them, that could be a worry. But I imagine for many of these schools who would actually do some of this, and this is part of the work we do, the State School Mental Health Collaborative, is getting to see it's not as scary as they may think, and that they do have great resources and great capacities within their school to help, maybe in ways that aren't always as apparent. So let me just keep moving forward for the sake of time, because I want to make sure we have some opportunities for questions. We're going to move into targeted support at the tier 2 level within this mental health continuum. And we're going to talk a little bit today about brief check-ins, group therapies, electronic school home notes, and then check-in, check-out. So a brief check-in is kind of like our go-to once we have students who have completed the screeners. And we say, you know what, these 15% of students are showing a little bit more risk than the general population. We'll bring those students in and do our 20-minute semi-structured conversations where we talk about well-being, suicidal ideation, as well as trauma, and get a sense about where they may be at. If needed, we can continue on with these 20-minute semi-structured conversations. We could do it bi-monthly. We could do it as frequently or as infrequently as needed. But this tends to be for students who are more at risk. So we wouldn't necessarily be working on therapeutic content, but more just like a touch point, just to make sure they're maintaining and doing okay. We'd ask similar questions if we had follow-up, and also check in with any previous information that came in. So this is like a nice one-off opportunity just to have a brief check-in with a student. The other thing you might think of, and this is going to be for students who maybe need more ongoing support at the tier 2 level, is how can we connect with home? And so this is just a great example. Our colleague who's emeritus faculty now at the University of Utah, Bill Jensen, created this with some colleagues. This is a really kind of package ready electronic school home note that allows folks to track the data, enter it. But the essence of this is a communication system between the school and the home so that we can hold students accountable for whatever goals that they have, particularly around mental health. And it might be check in when you're feeling frustrated or check in when you're feeling nervous and anxious. And so being able to communicate those things to parents and say, hey, the student checked in with me about these things today and did it in such a great way. And I appreciated how vulnerable but appropriate it was. Those are great things that build connection with families. The other intervention, this is by another emeritus faculty at the University of Utah, Dr. Leanne Hawken. She developed Check-in, Check-out and has had some really great initial work, especially for students with internalizing risk. So that would be like anxiety, depression. So we collaborated on a project that was recently published where we worked on that with a student in a classroom and found that it was really helpful to really help with more engagement in the classroom and help reduce some of these symptoms that we were really trying to reduce around being withdrawn and being kind of less connected with peers. This is a great intervention because it's a mentor-based intervention. So you check in with someone you trust at the school at the beginning and end of the day. Teachers will give you some rating of how you did on certain goals, whether it be like being brave to ask for help or to talk to peers. And then at the end of the day, they check in with the mentor, check out with the mentor again, and there's typically some incentive for being able to meet some goals. And that really helps because there's performance feedback throughout the day. So I really encourage you to use that for some students. The kind of more traditional way you might think of tier 2 mental health interventions is around group therapies and support. And so these are going to be a variety of different groups. These are just some of the manuals we use. But these groups typically would target things like problem solving, decision making, emotional understanding and expression, social skills and support, interpersonal and communication skills, conflict resolution, coping strategies, lots of skills-based groups so that we can really help to insulate folks and empower them with things that they can use as they navigate maybe more risks or things in their lives. And then, of course, this will bring us to kind of our tier 3 supports level. These are our individual supports where we have psychotherapy, we may have community collaboration, as well as progress monitoring. So let's jump in, talk a little bit about this, and then I'm going to stop sharing my screen so I can see you all really good, and we'll open it up for some questions and comments and just more of a discussion around the content that we talked about through these first like 45 minutes or so. So when we think about individualized prevention-based services and when it comes to school mental health, we're going to jump in and do therapy with students. But for folks who do this work, this may be the first time that they interact with a therapist, and a lot of your work might just be socializing them to the therapeutic process. And that's why I really think about the work we do, even though it's tier 3, it's individualized services, it still has a prevention lens, because in 10 years from now, when these students are in whatever capacity in their lives, and they may have increasing levels of risk, increasing levels of stress on them, they may have to access therapy or may think about accessing therapy. And so I think our jobs as school-based mental health providers at this individual level is to demystify and destigmatize mental health so that down the road, people can say, I feel a little bit more comfortable to access a therapist. And I think this is really important because we may not be able to solve these issues because so much of it is contextually based. But what we can do is start to empower with skills and normalize this experience of being in therapy to build skills and to be vulnerable in that way. So I really appreciate of what we can do, I think, in the school level at the tier 3 sense. We also have to think about community collaboration because there's a kind of a threshold as school-based mental health providers of what we can do, especially when it comes to things that circumstances that may need more long-term ongoing support. As all of us as school-based mental health providers, I think kind of one of the unfortunate parts of it is that most of our clinicians are graduate students, and so they go off and do great things and become clinicians themselves. And so because of that, we don't get the ability to follow someone necessarily always for 5 years and really have long-term connection with people. Sometimes we do, and that's great, but usually just because there's transition to schools, elementary, middle, high, we only get like 4 or 5 years max. And so really thinking about in certain circumstances, when can we utilize community partners? When can we connect with them and have them do their own therapy to augment maybe skills-based stuff that we're doing there? Or maybe take over some of the therapy because maybe there's more long-term trauma therapy that's needed, or there's more long-term skills that we have to develop that just really are outside of our capacity from a longevity standpoint of the school. And this also gives us the opportunity to think about medical providers, whether it be primary care providers or psychiatrists, thinking about all the community providers who help individuals. And if we can be more linked together, particularly if they're higher risks, there's more of a need we're going to have more success. Because when you hear people say it takes a village to do these things, it's like no joke. It really is. And if we are the only ones doing it, then there's no way we're doing it as effectively as we can. So this community collaboration piece at the tier 3 kind of individualized level, I see it as being central to our work beyond the time we're in the session with those folks. We also have to think about this level of progress monitoring. And this is something that we bring up. And for folks who are doing this work, you're in some ways progress monitoring this. We want to be able to say, our students we serve are getting better or not, so that we can adapt and make changes accordingly. Some of the tools that we've used and had some success with are the Youth Internalizing Problem Screener, which we can do every session if we would like to. It's a change sensitive measure, so it can monitor over time. Again, this one's free and also developed by my colleague, Tyler Renshaw at Utah State. And then there's a complementary externalizing problem screener. So these together, the YIPs and the YEPs, I think they created one document. I don't know what they call it though, the YEPs or something, is really the way to screen for these issues, but also monitor change. I like to do that at least within session. Okay, so let's orient back to this model again. We know it takes not just the work that we're doing in schools, but also what we're doing to connect with the community to provide these mental health supports. And knowing that for our students to be successful, we have to have these foundational supports. As you all know, for many of you who are graduate students on this call, if you don't have your support network, if you don't have those things, it's really hard to get through the day-to-day as students. And we have to think about the same thing for our students. And many of them are not as privileged, do not have the access to resources and opportunities that we might, where we have these great communities of support. So with that in mind, I want to thank you all for being here and listening to this presentation around school mental health. I hope for folks it resonates with some of the work you're doing, and maybe for other folks who aren't, give you some ideas about how we could fit into this model. Again, for the folks who aren't part of the lab, check out our lab website. If you're interested in this work we do, follow us on Twitter. And if you're interested in learning a little bit more, particularly around technology, I have to give a plug for the book we edited. You can scan this QR code and get a free first chapter, which is on teleconsultation. Okay, that being said, let me pause here. We have about 10 or 15 minutes for questions, and I would love to hear thoughts, things that are coming up for you all, or anything that I might be able to help with. I'm going to just stop sharing my screen so I can see you all a little bit better.
I have a quick question. Thinking about the integration or the communication with community members and kind of the stakeholders in the community. There's some controversy around like multiple mental health supports and doing therapy in multiple settings. What would you say to that in terms of having maybe a community provider providing some sort of therapy for a student and then having them also somebody in the schools?
Yeah, it's a great question, Derek. Thank you for asking that. It's interesting because I think as I've navigated different districts and like different community partners, there's definitely like a different feel from some of them. But I'll anchor it to, I think, our best community partnership that we have, which is with Hopeful Beginnings and Project Connections, which serves Murray schools and, for our case, Canyon School District. And what I think when it comes to that is there's plenty of problems that these individuals are facing that we work with. And to the extent that we don't want to have redundancy, I understand that point, right? They're like, oh, we're just going to target all these things and there's all the work to be vulnerable and do all that. However, we are really in a unique environment, I think, in schools to be able to take some of the stuff that maybe occurs in like a community-based mental health setting and really have that exist in ways, or at least progress monitor that and see the occurrence of those things in ways that community therapists never, I think, would ever be able to. And so what I would encourage, and I think what have been fruitful with some of our conversations with our partners, is how can we collaborate on substance level so we can both see the students, but do things that complement each other rather than feeling like we're both doing the same work. And I think really what that comes down to is, at least in the times it's worked, is really having that relationship where we talk to the therapist and say, I feel really strong about these things, or I think these are great opportunities. You're doing these things. How do you feel as the already assigned main therapist? I'm coming in, if I could do some of the skills-based work or generalize some of those skills. And I think usually if it's approached like that, it feels good. But I agree. And I think we've seen, especially in some of our other districts, some of that hesitancy around dual treatment. And I think that if we can be thoughtful, I think it's not good to do complete replication, but I think we can be thoughtful and have extensions. Other folks, feel free to jump in, but that's just at least my 2 cents about, the redundancy piece.
Thank you. I really appreciate that perspective and thinking about how we can have that integration. I also agree. I think that there's a lot of things like a community therapist can't really provide in an office setting that we can do in the schools. We can provide, like those in vivo exposure type things. If you're working on social anxiety or something like that, there's plenty of students, plenty of people to engage with. And I think it's a really good way to integrate the two. So thank you.
Yeah, thanks, Derek. I totally agree with you. I mean, I think if we only think about it in these siloed ways and be like, therapy only occurs within the therapeutic context of this room, then we were missing the mark. And I think for many of our our students, our graduate students around the schools, it's such a great application of the work. It's saying, like you said, we've done this exposure, whatever, in the space, but now let's do it for real. And let's have another trained person be there to help in that moment, be like, hey, remember, this is a great chance to take some of those deep breaths. Oh yeah. So I agree with you. I mean, I think we're all doing the same work. It's just like seeing therapy as this thing that exists, I think, within a room. I think, at least in my understanding, has been part of the impetus of people pushing back on some of that. Other questions? These are great. Thank you. I'm just going to read some of the comments that are in the chat just to keep the conversation going. And I appreciate everyone who's jumping in. Alicia, thank you for just mentioning how we can contextualize this concept of normalizing therapy to start with, and thinking of it as a long-term process rather than necessarily being able to solve some of these issues right away. And I think that's like such an important piece. And I think I learned that. I'm sure all of us who maybe have done this a little bit more had to learn that early on, that it's like, oh, sometimes we can't fix the problem, or how we fix the problem isn't necessarily readily apparent right now. It's how we've built those blocks. And so I always remind myself that. And I think for you all who engage in this work is to remind that your value as a therapist isn't determined by did the light bulb go on or off. It might be all the back end wiring that no one even knew that you were rewiring. So when the next time the switch gets flipped, it does turn on.
I have a question, more, I think, regarding to like access to mental health resources. Like, let's say you are working for a school where there isn't like an already established or existing like school mental health system, like there's no well-being teams or anything like that. What are some easy ways, or I guess, yeah, strategies that, I don't know, teachers or school staff can do to advocate for, like a push for like a need for mental health for students?
That's a great question. I think it really just, it's all about like grassroots efforts to get that critical mass at the school. So I think, if there is even one person, I guess maybe, yeah, let's just say there's 2 people at the school who really are passionate about this because they can empathize. Maybe they had a sibling who's had mental health issues. Maybe they've experienced it themselves, maybe their own child. And so I think finding those critical people and starting to have those slow and steady conversations, knowing that will take some time, but starting to create some consistency around meeting, some intentionality around talking about these topics, and then being really open, being really inclusive, and saying, hey, we want you to join. We want you to join. Hey, we heard that you might be interested in this group. Just come and stick around one time. And it's starting to build that coalition at the building level around mental health, and saying this affects me and this affects you, and it affects the people that all our students go home to and who we go home to. And so how can we start doing those things? But I think that paired with this idea that it takes time. And I think if we talk to like some of our administrators in our Salt Lake schools who we've worked with for, this is our 4th year, it took 3 years to get things going. It takes that time to get people bought in. And we started in the same way. There was a few people who really cared about the mental health of students, and then that started to spread. And so I would encourage folks to think about some of their consultative skill set in this too. It's like, how do they influence people? And usually it's through this idea of referent power, meaning it worked because this other person I know is into it and it worked for them, or they were passionate about it, and then we can start to build sort of that capacity. But I think it's a great question. And I think for people doing this work, you're going to start from a place where people might scoff at you or say, we don't have time for that, or why is this important, or how's this going to help? And it's just finding those other people who can start to see the value in these things.
Thank you. We have about 5 to 10 more minutes. If anybody has any last minute questions or thoughts, feel free to jump in the chat or, unmute yourself.
I have a question sort of bouncing off of what Annie said, and understanding that these systematic changes take time. Like it can take 2 years, 3 years, however long that is. But some of these students need help now, and there's a sense of urgency. And I'm just wondering what we can do in the interim between the time that like this program launches or there's more support for these programs. What can we do to help these students that need that support and they're not getting it?
Yeah, I think it's a great question. I think typically when we see these programs come into schools, imagine that triangle of MTSS upside down. And so really where schools start is they have no foundational tier 1, and it's all, let's just put out fires. It's all direct service when we start. But that helps us in the sense that we can immediately meet a need at the school level and start to help students, like you're saying, who need those supports. So any of the schools that we're with, there are no kids who don't get the supports. Now, there might be inequities in the fact that they don't have great social emotional learning in their classroom. And that the only way to do that is through time. The only way is time and great influence. Now, if we feel like at the school, we're still not meeting their need, despite us, in the beginning, prioritizing tier 3 services, trying to do these things. And that's where we have to say there are community referrals. You need this help, here's this other place. Or if we feel like the perpetuation of the things that are happening within the school are the things that are contributing to the students' mental health issues, then I think that creates an impetus to have more pointed conversations with administration about these data that you find. Hey, all of these students who are getting referrals for all feel really not connected to school, really badly not connected. And here's why. They all go back to this idea that they don't feel welcome because no one says hi to them when they're around the building. Okay, well, we can do something about that. And so I think it's this mix of saying, what are our resources that's available, but also what is the nuance that we're going to have to creating this change. And I think that's driven by, like you said, the necessity of the student need in those different circumstances.
Thank you.
I hope that answered your question. Okay.
Yeah, it did.
I had one other question kind of around these services. So say there are some maybe basic services available. There's a school counselor, social worker, somebody like that, and then teachers, of course, who might have some just rudimentary knowledge of social emotional learning. You mentioned some of these kind of bigger, more intensive things that can come up for somebody, thinking about like traumas and longer term therapies and eating disorders and that kind of stuff. What would you say to individuals where a student comes to them and says, hey, I think I might have an eating disorder, or they're presenting with those kinds of symptoms, and the person's like, well, where do I start? What do I have the capacity to do, in here, without just being like, oh, well, I just have to refer you out, because obviously that's going to be part of the process. But what can I do right now to help this individual in the school setting?
Yeah, that's a great question, Derek. And I think, it reminds me, particularly for folks who are getting into this work, to know that like you have to, it's not like a handoff and that's it, right? Like if these situations come up, there's a lot we can do before they're even seen by the long-term therapist. And again, it might not be that we're diving into the underlying reasons why the individual has an eating disorder, but it might be, what can we do to help build resilience in the short term? What can we do to help with communication, safety behaviors, harm reduction type behaviors? There's a lot that we can do as like a preventative care. And so I would always encourage folks, what can you do to prevent things from getting worse? That's definitely within our wheelhouse as school-based providers. And then it's what can we do to try to resolve those issues. And I don't know if necessarily like Derek, I think your example of like needs, or I don't know if school-based providers will have we could have the capacity to do that, but we could give some skills to prevent things from getting worse, right? Like help reinforce the stuff that's there. And that's the space that I think we should all look at, because then by the time they get to the community therapist, they'll say, have you been working with someone? Seems like you have some of this stuff. It's like, well, this school person that I work with, like talking about these things, and I felt really supported. Okay, awesome. And then I think that helps to build more of the community partnership too, because they value us as school-based providers, not just like putting our hands up saying, look, can't help here.
Awesome, thanks.
Awesome. Thank you, everybody, for your engagement, your thoughts, and your questions. I think we're going to go ahead and wrap up today's webinar. Again, a huge round of applause for Dr. Aaron Fischer. Thank you so much for participating. Please visit the U-TTEC Lab website, which you can access by typing in U-TTEC.lab.com for any future webinars and everything related to school mental health content. Again, thank you so much for joining.